Dr. Madeline here at Forward Spine Center, and today I'm going to talk to you all about acute ankle sprains and provide you a few clinical pearls that you can take at home to take care of that ankle sprain. So what is an ankle sprain? An ankle sprain often occurs when you jump up and you come down on your ankle and you twist that ankle past that normal range of motion. Or maybe you're playing pickleball and you step onto that right foot and you feel that ankle joint twist. And what happens is that ankle joint twists and you end up tearing one or more ligaments along that ankle. You can either happen medial or lateral. I'm going to talk a lot more about lateral ankle sprains because it is a lot more common. And you tear one or more ligaments that run along and stabilize that ankle. It may come with a feeling of tearing, an instant feeling of pain, or that pain can come on 1 or 2 days later. You may feel a pop, or you may see some swelling or instant bruising. I recommend keeping your shoe on. That shoe provides compression. If you do feel a pop and you continually feel pain, maybe along the outside of that foot, that may mean that you fractured that fifth metatarsal. That may warrant an x-ray. Come in, we can use a tuning fork, and we can rule out any osseous inflammation in that area. How you can manage this at home: prices. P, protection. So wearing good, proper shoes. R is rest. There's 3 grades of an ankle sprain: grade 1, 2, or 3. Grade 1 and 2 mean we want to get some range of motion back in that ankle joint. Grade 3 may require more immobilization. So relative rest. Right away, provide some rest onto that ankle. Don't go out and keep playing basketball, or give your foot time to heal. But you do want to get some motion back in that joint. Motion is lotion. So we want to, the more that we can pump, the more that we can move those ligaments, it's going to provide that pumping sensation, and that's going to decrease that inflammation. So prices, that's how you take care of it at home. PRI, ice. Ice, cryotherapy, anything to help decrease that inflammation. C is compression, along with keeping on that shoe right away after the injury. Compression, maybe using an ACE bandage, some kinesio tape, anything to kind of keep that compression, that inflammation down. And E is elevation, keeping that foot above the heart. How we can help, along with tearing of that ligament, you damage the receptors. So our ligaments, you may hear when someone twists their ankle, they're more prone to twisting it again. Well, what happens when you twist your ankle, you damage those receptors, those nociceptors in your ankle joint, in that ligament. So it's when you damage those receptors, you don't feel it as much. So when you don't feel that ligament, so let's say you're walking over a step or a curb and you want to be able to feel those ligaments, and that's going to help to fire so you don't twist that ankle joint. But if you damage those receptors in the past, you're more prone to twisting them again. So what we need to do is we need to properly retrain those receptors to turn back on. We do this with certain rehab. We also use acupuncture. Acupuncture helps to kind of turn back, to heal those receptors, to turn it back on. If you have sprained an ankle, sometimes it also means you lock up a joint. So let's say you sprain this ankle this way, that lateral ankle. Well, you may have locked up part of your other ankle joint. So how chiropractors, how I can help with is we also make sure that that joint is moving freely, and also making sure that it doesn't irritate the knee and the hip. So we move everything else. We make sure that all the other joints are moving. If you have any questions, please feel free to reach out. That was a lot of information in one video, and I have a lot more information that I would love to share about to you. And a lot of times it's individualized. So really making sure that we take care, if you've injured your ankle before, how can we prevent this from coming on again? Because we really want to make sure that we get you back on the court, on the field as fast as possible, but also injury-free and preventing that injury from coming back. So if you have any questions, feel free to reach out. Thank you for allowing me to be part of your health journey.